When it comes to your dental health, get the whole story. Dr. Charles Martin reveals a list of the top 7 things your dentist needs to check. I'm thinking your teeth would be up there. Let's get the obvious out of the way here. What are? Well, we'll save the top 7. Let's get people treated here.
Okay.
All right. Where are we going to start?
Well, I think one of the biggest threats to people is the fact that they're undertreated. Mm-hmm. And the reason they're undertreated is they underchoose care. They put it off, they delay it, or they'll use what I call false economies. They'll choose to do a methodology that's a patch, what I've talked about before, duct tape dentistry, which invariably fails. And in doing so, they put themselves and their teeth at risk. So one of the biggest threats is undertreatment. So that's on the patient side. But dentists as a group are pretty good folks. They want to treat people well, and they want to be liked. And so you come to me and I've actually had patients say, "Oh, don't find anything." I want you to look, but don't find anything. Like, oh yeah, that's going to work. So there's a natural tendency. We don't want to know there's a problem, but in reality, the only way to handle a problem is to face it, take care of it. Yeah. That way, you keep it small.
Can't ignore it, or it will definitely grow.
It will get to you.
All right. What are the 7 things every person should be checked on?
Obviously, this is a list. Okay. Obviously, dental decay. Number 2 is gum disease, and of course, we know with gum disease, it affects your whole body, including heart problems, stroke, blood pressure, respiratory problems, diabetic conditions, a whole number of things that it affects. So that's very important.
And those are the 2 that I think everybody thinks that's what the dentist does. They check your teeth, they check your gums, you're good. Yeah. See you later. Come back.
The next one is bite problems, because if your bite doesn't come together correctly, it hastens and worsens all sorts of other problems, and it changes the way you look. The next one is the wear and suitability of the existing dentistry you've had done. Dentistry does wear out and does have to be replaced.
You mean it doesn't come with a lifetime guarantee?
Unfortunately, not much does. The only thing we know about death and taxes. But then the next one is smile. How is your smile? Is your smile an asset? For many people, their smile is not the asset it could be. The next one is an oral cancer screening. That's number 6, and it should be checked for that. Just the other day, I found someone, unfortunately, who did have a problem, had a lesion, and that was disconcerting.
Did they know that when they came to see
you?
No. No.
They didn't know.
So you found this?
We found it, yeah.
Okay.
And the last one is, how well are you doing with your home care? A lot of people think that they're brushing well, cleaning well, and they're actually not, because they're not using the right technique or just missing places. So, it is a very common thing for people to spend 30 seconds brushing their teeth, and it should be at least a couple of minutes.
Okay. All right, let's take a look at another one of these before and after shots, and we've got one on the screen now. Tell us about this story.
Well, this gentleman had a busy life as a small businessman, and really had just delayed getting things done well. So we put him back together again using dental implants and cosmetic dentistry, and now he smiles all the time.
Looks a lot younger, too.
Yeah, it looks a lot younger,
looks
true.
Fantastic.
Yeah.
All right, so if you'd like to know more, don't put it off. Get everything checked out.